Hi everyone. Go ahead and get started. I'm Quinn Nguyen, a research associate here at the Blanco Center at UL Lafayette and coordinator for the Whole Health Louisiana project. I hold a master's degree in social work and public health from Columbia University, and I will be facilitating today's webinar and all of the Lunch and Learn webinars to come, along with my colleagues here at the Blanco Center. If you're unfamiliar with what Whole Health Louisiana is, Whole Health Louisiana is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood diversity within our systems of care and support. Whole Health Louisiana has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, Whole Health Louisiana's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. The Louisiana Department of Health serves as the public sector anchor and funder for the Whole Health Louisiana project, and the Blanco Center is leading the plan's implementation and evaluation plan. As part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen the conversation on trauma-informed care practices. Our virtual Lunch and Learn series touch on the workforce priority area of the Whole Health Louisiana plan and features presentations from industry professionals and subject matter experts. We have a webinar planned for one Thursday of each month through June, and each webinar will touch on various topics related to the goals and objectives of Whole Health Louisiana. Our planned webinars are listed on the Eventbrite page that you all use to register for today's event. And in addition to the webinar series, Whole Health Louisiana is conducting in-person regional trauma-informed care training sessions across the state of Louisiana, with our next one in New Orleans. If you're interested in attending our next regional training, feel free to contact me or any of the Blanco Center staff, or check in with the link that is dropped in the chat. All right, so now all that is out of the way, I'm going to go ahead and introduce our speaker, Dr. Allison Boothe Trigg, who is here with us. She received her bachelor's degree at LSU, a master's in clinical psychology with a focus on family therapy at Pepperdine University, and a master's and a doctoral degree in clinical psychology at the University of Alabama with a child and adolescent focus. She is a clinical psychologist, associate professor, and the psychology division chief in the Department of Psychiatry and Behavioral Sciences at Tulane University School of Medicine, where she co-developed the TIKES infant and early childhood mental health consultation model, which has been funded through the Louisiana Department of Education to provide infant and early childhood mental health consultation to early education sites. And she will be talking to us about some of that content today as well. She has also published peer-reviewed articles on infant and early childhood mental health consultation and is a regular contributor to the National Center of Excellence for Infant and Early Childhood Mental Health Consultation. She has also co-edited the book, Managing Behavioral Issues in Child Care in Schools, a Quick Reference Guide, published by the American Academy of Pediatrics. Dr. Trigg's research interests focus on evaluating infant and early childhood mental health consultation and supporting early childhood caregivers. Let's give a warm welcome to Dr. Trigg, who will be speaking to us about her research interests. I'm going to hand it over to you. You can go ahead and put your slides up.
All right, thank you so much, Quinn. It's always, it's never fun to sit there and listen to a bunch of information about yourself. So I appreciate you and you having to say, and I apologize for you having to say infant and early childhood mental health consultation so many times. I'm used to it, but it is a mouthful and it makes things go a long time. So welcome everyone, and thank you so much to Whole Health Louisiana and Louisiana Department of Health and the Blanco Center for asking me to be here today. It is an honor. You guys are doing amazing work, and I'm glad to have a small part of that. To get started, I want to give a thank you to all of the people that I get to work with who do this work, supporting infants and young children every day. And this is a picture of most of the folks. We have a few new additions on our Tulane Mental Health Consultation Services team. It includes our TIKES team, which provides consultation services across the state and is funded through the Louisiana Department of Education. It also includes our City Seats team, which is funded here in the city of New Orleans through a property tax millage and is administered through the City Council and Agenda for Children. We also get to serve Jefferson Parish Head Starts and Early Head Starts through funding from Jefferson Parish. So there are a lot of people out there doing really good work, and I'm going to highlight some of them today. To get started, I wanted to look at the Whole Health Louisiana plan, and Quinn already mentioned and went through the vision, and that really fits with what we're going to be talking today. And I also looked at some of the desired outcomes that I'm hoping will fit with our conversation. And they are things like increasing the robustness and support of the child and family serving workforce, reducing occurrences of childhood adversity, increasing healing, and improved equitable health and life outcomes. So I'm keeping those in, I kept those in mind while I was putting this talk together, and hope we can keep them in mind as we're moving. So let's get started with what is infant mental health. And I'm going to really use the terms infant mental health and infant and early childhood mental health interchangeably as we go through today. And infant mental health is not a baby on a couch getting psychoanalysis, but it is a young child's capacity to experience, regulate, and express their emotions, to form close and secure relationships, and to explore their environment and learn. So it's really taking into account all of those key foundational developmental aspects of early childhood. And they are developing within the capacity and the context of their caregiving relationships. So that is, yes, definitely their family and their home caregivers, their parents, but also their community and then the cultural expectations that are in that particular culture for a young child. When we are thinking about the guiding principles of infant mental health, there are 4 primary ones that we want to keep in mind. And it's that infant mental health is at its core relationship focused. So we are consistently using relationships as the primary framework for understanding young children, for thinking about any concerns that arise, and for putting together interventions. It is at its core strengths focused and prevention focused. So what's going well? How can we keep that going well and prevent negative things from happening? And then it's multidisciplinary. So while mental health is in the title of infant and early childhood mental health, the support and the awareness of infant and early childhood mental health is really incumbent upon all of us, for our communities, individuals, and professionals, anyone who's interacting with young children and families, to think about how we can support the healthy development of young children and support their caregivers. So if we're thinking about intervention, that's when mental health professionals need to be involved, but overall it's a multidisciplinary field. So when we are thinking about young children, we have to think about their primary caregiving relationships and what their early experiences are. And infant mental health really focuses on understanding how do infants experience their world, and how do they do this in the context of their relationships. If you think about a newborn, that newborn cannot survive without adult caregivers. It is key for their growth and development. So those first relationships and those first experiences are paving the way for healthy brain development. We know brain development is going to be influenced by genetics, what we're born with, as well as experiences. And we're going to talk some about those today. We also know that those first experiences are so important. And there are sensitive periods for young children. And that's one of the things that Whole Health Louisiana is having us think about infant and early childhood mental health today. Because positive caregiving experiences and positive early environments are super important for young children during their first 2 to 3 years of life. And we have research supporting these as being really sensitive periods. And in one study in particular, it looked at children who had experienced extreme neglect. And if those children were placed into a supportive foster home before 24 months, they went on to have higher IQs and having more typical attachment relationships with their caregivers than those children that were placed after age 3. So it's important to note that there's no age at which children can no longer make improvements, but the earlier that we can get in there and keep that environment positive and help that child have supportive relationships, the better their long-term outcomes are going to be. When we're thinking about the developing brain, you know, it's not new news that a whole lot of brain development and important brain development is happening during the first years of life. So I just want to point out that the healthy relationships that young children have is vital to that brain development, because it's through these relationships that young children wire their brains to learn who they can trust, how they can feel secure, how they can feel safe, so that then they can go into their environment and learn. And then through those relationships, along with positive early experiences, connections are formed in the brain. And these are modified through consistent interactions with their caregivers. So when children are given a consistent and secure environment, their brain develops gradually in response to these positive experiences and this positive environment. So that's what we're looking for in our young children. And here is the graph. You know, I'm sure you've seen some model of this before, but this is just showing us the great amounts of human brain development that are happening in the first year of life. It starts prior to birth, and then huge amounts across language, across sensory pathways, and yes, for higher cognitive functionings happening so much in that first year of life. It continues on after that, but that time period is another one of those sensitive ones where we want to create those environments and those relationships to support this brain development. So let's dive into relationships a little bit more. What relationships are most important for young children? And it's the attachment relationship that a baby is developing with its primary caregivers that we want to focus some on. What is attachment? It's one of those terms that can be used regularly in regular conversation, but when we're thinking about it in the field of infant mental health, we are thinking about this specific definition, which is that attachment is the pattern of relating that occurs between an infant and their caregiver. And it includes a range of feelings that it's experienced in that relationship, including pleasure. And attachment was really first discussed by Bowlby in 1969, and he described it as an emotional bond that develops between an infant and their caregiver. And again, it's that pattern of interaction. So it's developing over time between the baby and their primary caregiver. And it impacts the infant's capacity to regulate their emotion, to regulate their arousal level within the context of their relationship. And this early quality of engagement between that baby and their caregiver has implications throughout their life in terms of how they make relationships over time. So this next slide will look at the stages of attachment. If you've spent any time around a baby, you will recognize these. In the first 6 weeks of life, babies are pretty happy as long as their needs are being met. So this is a great time to support someone in your family who has an infant and they want to take a nap. That baby's going to be okay as long as his needs are being met if you're holding him. And then from 6 weeks to about 7 months, infants start to show a preference for some caregivers. And this preference grows until around 7, 8 months when a discriminate attachment should be forming to a particular caregiver. And this is when stranger anxiety develops. This is when babies start to get upset when their mom or their dad is not there caring for them. And that's a good thing. It's positive when we see stranger anxiety because it's showing that this child notices and recognizes that their main caregiver is caring for them. They know what to expect. They know that caregiver is going to keep them safe and provide for their needs. And the good news is that after that, those first primary attachments occur, that then babies will start to develop multiple attachments. So this may be with grandparents, childcare providers, aunts, uncles, godparents, etc. So children then can go on to develop other attachments. And why are we concerned? Why do we want children to have these secure attachments? Because not only does it, like the term imply, if a child who's securely attached feels comfortable and confident in their relationship, but we know from research that securely attached children have better emotional adaptability. They're able to control their emotions better, their social skills are better, and they even have better cognitive functioning, which makes sense when we think back to that graph showing us brain development if children are learning through their relationships. And this graphic here is really a nice model to help us think about how secure attachments support brain development and growth for young children. And you can look at the hands as the hands of the caregiver of that primary attachment figure. And a child who feels comfortable and confident in their secure attachment can go out onto the circle, so that's the top part of the circle, and explore their environment, begin to learn about the world. And when they're doing that, they need their caregiver to support them going out and exploring, to watch over them, to delight in what they're doing, to help them if they're needed, and to enjoy what's happening. But when something occurs that the child realizes they need support, maybe they're scared, maybe it's a new experience, they need that caregiver to be a safe haven for them, to welcome that child coming back, and then to protect or comfort them and continue to delight in them and to help them organize their feelings. So yes, that dog barked really loudly and that was scary for you, but look, he's behind the fence and I got you and you're going to be okay. Yeah, I know that you're crying a little bit. Let me rock you. When a child learns to help organize their emotions through their caregiving relationship, they can then start to do it on their own. And over repeated interactions of the adult always being bigger, stronger, wiser, and kind, the child learns to organize their own feelings and their own emotions. We can't just stop there, though. We have to think about the cultural context for infant mental health and forming attachment relationships. And culture is another term, like attachment, that we use a lot. But what does it mean? What are we talking about when we say culture? And so we are talking about here that culture includes attitudes and values and beliefs and behaviors that are passed down from generation to generation, but without explanation. So we have a lot of culture here in Louisiana, and we may contrast our Louisiana culture. You know, it's getting a little cool out, and so we're going to eat gumbo, as different than what might be happening in the Northeast when the weather gets a little cooler. That's an example of culture, and there are many, many. And culture is impacting core parent behaviors, and particularly core parent behaviors such as discipline and socialization. They are impacted by complex interactions that occur between attachment relationships, both that parent's attachment relationship is when they were being parented, as well as cultural norms and how individuals are socialized. So one example of this, or a way of thinking about this, is that young children learn about emotion regulation within their attachment relationship with their primary caregivers. And that relationship exists within a culture and within a community. And studies have found that, for example, maternal support for children's expression of negative emotions is different if we're looking at white mothers versus African-American mothers. So for white mothers, there are positive outcomes for their children when that child is encouraged to express a negative emotion they may be feeling, so sadness or anger or frustration. But for African American mothers who support their child in also emoting that negative emotion, there are actually some negative outcomes for the children. And this is particularly in terms of academic performance and peer relationships. So could this be because society views negative emotions differently in African American children than white children? Potentially. But this is an example of how we have to, when we're supporting young children and their caregivers, look at the cultural context that exists and impacts their relationship and how they parent their child. So when we are supporting young children and their caregivers, we really have to think about what each parent and each caregiver is bringing to that experience, their own experience of being parented, their own attachment experiences, their cultural experiences, as well as any trauma history that could be theirs personally or historically within their community, and that all is going to impact their role as a parent. So it's a lot to think about, and we could spend an entire hour talking about this today. But we have a lot to get to. So this is a quick model it looks simple, but it's really quite complicated because we have attachment, culture, and trauma all impacting each other. And also on this triangle are thoughts and questions and beliefs about culture and trauma and attachment relationships that are all interacting with one another. So we have to consider all this when we're working to support healthy child development. And if anyone is interested in learning more about how to support a diverse group of children and families, I encourage you to seek out the Irving Harris Foundation's Diversity Informed Tenets for Working with Infants, Children, and Families, because it really offers nice guidelines to think about how to best support multiple individuals from multiple places. So I'm going to move into what some supports are to support infant and early childhood mental health. And I like to start this by thinking about resilience. We hear a lot about resilience, and we know that some children demonstrate a capacity for resilience, which is, an ability to overcome a serious hardship. And I think it's always so important to note that children do not become resilient alone. There's always at least one stable relationship, a stable, committed relationship that supports that child in getting through a hardship. This could be a parent, a teacher, or someone else in that child's life. But children aren't going to be resilient on their own. That impact of a relationship is always going to be there. I hope that through programs and focuses from places like Whole Health Louisiana, that we can create a world where fewer children need to become resilient, and instead we're supporting healthy development. But in order to support resilience with where we are now, we need to think about those relationships that young children have. And if we're thinking about relationships, we have to be aware that parents and other people who are caring for children at home, so grandparents or kinship care, they're struggling. And this is not necessarily new. The parents of young children historically have reported higher levels of stress than parents of older children. But COVID-19 and the COVID-19 pandemic really exacerbated issues that were there. So this is just highlighting a few different studies that are out there. There was one meta-analysis, which is looking at a whole lot of different studies at the same time and looking for similarities across them. One looked at 18 studies and found across those there were increased levels of depression and anxiety in mothers of young children during the COVID-19 pandemic. Probably not surprising, but to most of us. Similarly, since COVID-19, one study found that the pandemic exacerbated pre-existing vulnerabilities. So increasing barriers that were already there, increasing perhaps those levels of stress that were already there for young children, making them that much more. And then another meta-analysis found that the pandemic was detrimental to maternal mental health, the healthy development of young children, and parenting practices. That's a major trifecta. And most of these studies were looking at maternal mental health. And so it's hard to tease out, was the maternal mental health what was impacting child development and parenting practices? So obviously more needed to be studied, Well, what this tells us is there are a plethora of studies letting us know that young children's primary caregivers are struggling. And so we need to think about supporting them. The good news is there are evidence-based treatments for young children and their caregivers. When we are looking at concerning behaviors or developmental concerns that might come up with young children, we must involve their caregivers. Like we started off today, infant mental health is inherently relationship-based. So we are not going to be treating children alone. A 2-year-old is not going to go to therapy by themselves. A 2-year-old may go into treatment with their primary caregiver. So these dyadic treatments, as we call them, treat both the parent and the child. And some examples are PCIT, parent-child interaction therapy, or child-parent psychotherapy. These work, but access is limited. Treatment takes time. When you're treating a dyadic or a dyadic partnership, you are going to take weeks or even months, depending on what the presenting problem is. So we know we can show positive impacts with these, but we need more people that can provide these trainings. And so this is when we think about how big programs can support, is we need increased funding for training for mental health professionals. To do these well, people need good training, and we need funding for the treatments themselves so that we can have greater access. In my statewide program, we have about 20 consultants who are in child care centers on a regular basis, and they are wanting to refer children and their caregivers. But in many areas of the state, there is no one to refer to because there isn't training and there aren't people that are doing these dyadic treatments. But here is an example of health promotion and prevention of difficulties at the community level by not mental health specialists. But this is through training grounds. Actually, one of the people who runs them is a mental health specialist, but they're not providing particular therapy. Instead, they have created these wonderful play spaces. They have 2 in the New Orleans area, and they are really like fully outfitted childcare centers. They have developmentally appropriate toys for ages 0 to 3. They have outdoor space, they have indoor space, and they welcome parents to bring their 0 to 3-year-olds in and to play with them. It is staffed with experts in infant mental health and child development. They can answer questions. It creates a sense of community. Parents can get to know other parents and talk about what it's like to be raising a child. So when we look at everything that a place like this can offer to parents who may be stressed and needing support, the We Play Center at Training Grounds really offers so much for their community. And then they also offer additional things beyond these play spaces, which is parent training on developing child, support groups, baby cafes for pregnant moms, and it's free of charge for parents. So it's funded through grants and other funding sources. And it's really such a wonderful example of how the community is working to serve its community members in a way that's not pathologizing, but that is promoting and preventing problems from occurring. So really that strengths-based focus for infant mental health. I want to move now into thinking about early care and education as a context for infant mental health. And it's important, I'm doing this work all the time, but it's important for us to think about caregivers that aren't necessarily at home, because almost 68% of the children in the US as of 2022 had all of their available parents in the workforce. So we have over 14 million children whose parents are working to access or who are using non-parental care for their child. So it's typical that children in the US are being cared for out of home. And it's not necessarily a bad thing. We have studies and we have longitudinal studies that show us that being cared for in a high quality environment in early care and education is associated with positive child outcomes across multiple domains. So better cognitive and academic skills, great social skills, better language development, increased emotional skills. And some of these positive associations occur through things like increased high school graduation rates and on into adulthood. So high quality care in early care and education is important. And it can also be protective for young children who may be experiencing adverse events as a young child. So in particular, studies tell us that high quality childcare can actually protect a baby from the negative effects of potentially living with a mother who has depression. So if they're able to go into a high quality setting, they may not be impacted by the experience of living with a depressed mom. Hopefully we can also get that mom into care. But even if that doesn't happen, that child can have some protective factors of being in a high quality setting. Another study has shown us that children living in poverty who attended high quality care had more positive interactions with their mother. So by being in that quality care setting, we are impacting what's happening at home. And there are probably many different routes that is causing that change there through. We also know, we talked about attachment earlier, and we were kind of mostly thinking about the home caregiver, the parent or the grandparent. But in the US, children typically form attachments with 1 to 4 adults. And childcare teachers are often one of those attachment figures for young children. So we saw the circle of security graphic earlier. This can also be applied to the childcare setting. It's a busier circle because there's so many circles on here, but that childcare teacher is the secure base from which children can go out and explore their environments, but also that safe haven for those children to come back to, be filled up and be supported, to be delighted in and to be comforted in. So the childcare teacher is an attachment figure when things go well for the children in their classroom. I have experiences with this when my children were in childcare. We still remember my daughter's first childcare teacher, Miss Monica. She was amazing. We still have her book from when we left because she was the secure base and safe haven for my daughter for a while. And I'm so glad we had that experience because it really just improved her well-being throughout her life by being with Miss Monica. So let's dive into what not just my experience, but what does the research tell us about attachment with childcare teachers? Well, it tells us a good bit. Children who have mothers who are less sensitive, who are also attending lower quality childcare, are more likely to have an insecure attachment with their mother. We want to have that secure attachment where the child knows what to expect from their primary caregiver. So if they're not in high quality childcare, less likely to have that secure attachment. For children who may unfortunately need to be removed from their home and they have a disruption in that attachment because they're placed in foster care, if that child can stay in their childcare placement where they have an attachment to a childcare teacher, this can lessen the negative effects of losing their other attachment figure, their parent. In my experience of working in my earlier career with children who had been placed in foster care, unfortunately, often children are also removed from their childcare placements. So this is something we can think about from a policy perspective of having not multiple transitions at one time when a child is removed from their home, but allowing them to keep that childcare attachment for as long as possible. And we also know that high quality childcare centers promote attachments between children and teachers because it's so important for that child's development. So overall, when we're looking at high quality early care and education, strong attachments with ECE teachers protect children from adverse childhood experiences. So how do we support quality early childhood education, and how do we build strong attachments within those systems? Well, first, and this is happening on so many levels, but we need to do more of it, is continuing to support our communities and recognizing the importance of high quality early childhood education settings and of early childhood education teachers. The Louisiana Department of Education is doing a lot of this right now, and we are glad to be a part of that. And one particular way that that's happening is through the Early Start networks and the Ready Start networks that are really looking at a community-wide level How can we increase awareness of the importance of early childhood education and support teachers and families? We also need to support our teachers' well-being. I'm going to get into that in a minute. And then we need to think about how can we consistently increase access to high quality settings. And then the importance of continuity of care in early childhood education settings. And I'm going to dive into continuity of care a little bit because I think it's something that's not talked about as much. And it's really focused on attachment. So when children are moved between classrooms, especially between the ages of 6 weeks and 36 months, it disrupts their attachment with their childcare teacher. And we know that that teacher may be one of their primary attachment figures. So when centers support continuity of care, it allows that child to remain with their teachers over a particular time period. And this is going to help keep that healthy, secure attachment going. The National Association for the Education of Young Children encourages continuity of care for 2 or 3 years. And it also can support family relationships. When the parent gets to know their child's teacher, they can communicate more quickly. Peer relationships can develop and stay together over time. And when we don't have continuity of care, so if we have children moving classrooms, sometimes some places it's every 6 months, some places it's every year. When we see this discontinuity of care, and there are more frequent changes of primary caregivers, we may see things like increased aggression, more externalizing negative behaviors, more withdrawn behaviors. And, this is where our consultants are often called in to support children who are showing behavior problems, or what teachers see as behavior problems in a classroom. And often it's when a child has moved classrooms and we'll hear, well, she was doing so great with her last teacher. They really knew each other. And, this new classroom is more difficult because there are older kids, and there are different expectations. And that's definitely part of it. But I think also it's the loss of that attachment figure that we're seeing there. Not surprisingly, when there are frequent teacher changes, it's also associated with things like the child and the teacher aren't as close. And we don't think very often about how happy is a child in their childcare program. We don't think about what the child is feeling, but children aren't as happy when they're switching teachers a lot. But another thing that contributes to discontinuity of care is teacher turnover and teachers leaving their center or leaving the workforce. And it's not surprising that they are doing so because our early childhood workforce is struggling. In a study in 2022 of Louisiana Child Care Center owners and directors, 90% were losing valuable teachers and having staffing difficulties. And the teachers that were staying with them were being asked to do more, which probably contributed to them potentially leaving in the future. If we look at median wage of childcare teachers, it's low. It's $9.77 most recently in Louisiana. National average still low, but a little bit higher. Southern average a little bit higher than Louisiana. And there's a lot of disparity across that pay too. Head Start teachers are paid a lot more than private childcare teachers can pay. Private childcare centers, can pay. And it's understandable. The private childcare owners are struggling with so many things. They're trying to meet ratios. They're trying to train teachers. They're trying to keep their costs low enough that parents can afford this. So it results in, if you're a single parent and you're working in childcare, you could be working full-time and be below the poverty level. And so it's not surprising that we have teachers who are good, who are choosing other fields. So we're seeing high turnover. We're seeing increased workloads. And Louisiana has been thinking about this. We have the school readiness tax credits that are available to teachers. And these can be paid to teachers even if they don't owe any income taxes. But we need to consistently think about how we can do more. And this is important for those attachment reasons, but also because teachers who are stressed and burned out, even if they're staying in the classroom, if they're stressed and burned out, they aren't going to be as good at providing consistent emotional support or that positive behavior management. We know teachers that have high stress aren't able to model positive emotions as much as we would like them to. And teachers that have high stress, they have more conflict with their students. If any of us think about what it feels like when we're at that really stressed out point, we're probably not the best versions of ourselves. And yet we're asking our early childhood teachers to deal with a lot of stress inside and outside of a classroom and be loving, warm attachment figures for all of the children in their classroom. And something that I think is really interesting is this last bullet point, which is a study that demonstrated that teachers who had higher levels of stress perceived their students differently. They perceived them through a more negative lens, as having higher levels of anger and aggression, having lower social competence. So these levels of stress are really impacting the care that teachers can provide. And when teachers aren't having these high levels of stress, their ability to be responsive and warm is key in creating the healthy emotional classroom climate that we want. We know that when teachers are able to be sensitive and responsive in caring for the children in their class, that it scaffolds children's development across multiple domains. And that pre-K students who had teachers with high scores, and this is on that class measure that the state uses for quality, in teacher responsiveness, sensitivity, and instructional quality, that when the child went to kindergarten, they had greater gains in language and academic skills and social skills. So having teachers who are supported and there increases how well children do as they move on into more academic fields. So what can we do? Well, I got to spend a little time talking about my program, but infant and early childhood mental health consultation is one of the primary supports that we have available for early childhood education settings. And it's one that the state of Louisiana was really on the forefront of blending into the quality model for their state. And so we here at Tulane, we have been providing that mental health consultation to child care centers in Louisiana for over 17 years. And we have been sought out by multiple other states on how to do this work. And what is mental health consultation? Well, it's an intervention that teams mental health professionals with early childhood professionals to improve overall health of young children. We primarily do it in early care and education settings, but it can occur anywhere where children and caregivers are. And we really work to support caregivers in understanding the impact they have on young children's development. A key thing to think about when we're thinking about mental health consultation to any setting is that it works best when programs have these three components. This does not work well as an individual provider going into individual settings, because we really need the support of the infrastructure of the program. The professionals need to have a mental health degree and be licensed or working towards licensure, and they need a lot of training in infant mental health and in consultation. And then the services need to be constantly evaluated to provide high quality services. And so when those are in place, across the country, we see benefits to children and teachers from mental health consultation and to children and families. So things like improved teacher-child interactions, improved classroom climate, decreased burnout and stress, reduced rates of expulsion, which results in less work missed by families. So a policy point there, as well as reduced challenging behaviors for families. So some quick findings from our program evaluations. Our TIKES program, after working with a consultant for 6 months, teachers report increased personal teaching self-efficacy, increased teacher influence over the children who are in the classroom, and increase teachers' feeling of their own competence to support social development of young children. We also, prior to the Department of Education using the class measure as their primary measure of quality, we used it to see if we were making a difference in classroom climate. So we had teachers who didn't know the class and consultants who didn't know the class. And after 6 months of consultation, on the class pre-K, all of the areas that we measured improved. Negative climate decreased, it did not increase. And most recently, we looked at teaching stress, which is stress around a particular child. And we found that teachers with low to moderate stress saw their children in their classroom more positively after consultation. Teachers with very high stress around a particular child saw their overall classroom behaviors as differently. And we realized that we need to provide more direct interventions to those teachers with really high teaching stress. So as I near the end and the end of time, we really need to focus on investing in early childhood mental health and early childhood settings. So anyone who knows anything about infant mental health or early childhood is familiar with these returns on investment, but investing in high quality early learning care and access to healthcare from birth produces a 13% return on investment. If we start that in preschool, it's more of a 7 to 10%. If you're interested in more of the return on investment literature and you don't know about James Heckman, he's on the internet, he's great, go look him up. But I want to give another example of community sport and investing early on, and that is the Knowing City Seats program that I mentioned briefly earlier. And this is in the city of New Orleans. It's coordinated through Agenda for Children. It's paid for through a property tax millage, and it provides high quality childcare seats for about 1,500 children across 40 early care and education sites, and wraparound services for those children and families. And we're in our, I think, third year of this large of funding. There was some private funding before. And I'm so looking forward to seeing what the ongoing evaluation shows. But just from being involved in it, we have been able to support so many teachers and so many families in recovering and going through difficult situations, including natural disasters, gun violence, deaths in the family. We've gotten parents, teachers, and children evaluated and into treatment. There are many great partners involved in that. Our program TMICS, Thrive Kids at Children's Hospital here in New Orleans, Tulane School of Social Work, and obviously Agenda for Children for the coaching in the classroom. But it's another great example of how infant mental health can be health promotion, prevention, as well as intervention, because we're doing all of that in this program. So to conclude, relationships and environments, these are the primary factors impacting infant mental health. And so we need to think about how we can support our caregivers at home and early childhood education settings. And that each of us who interacts with young children can think about how we can support funding for those caregivers, because that is what's going to support our young children. And it's going to take us all. It's going to take us as individuals, as groups, as policymakers, as communities, as business leaders to really reach what this vision of Whole Health Louisiana is, which is that children and families and community members across Louisiana are healthy and thriving regardless of who they are or where they live. So thank you. I'm going to stop sharing.
Thank you so much, Dr. Trigg, and thank you to Nikki Barnes as well, our ASL interpreter. And I want to say thank you all for attending. We are now going to field questions in the chat, so you can go ahead and put any comments or any questions that you have in the Q&A box at the bottom, and we'll start answering them. I would also like to do a short reminder that if you are trying to get CEU credits, to sign up in the link that is announced in the chat, as well as take the Lunch and Learn post survey. And even if you are not getting CEU credits, we would really appreciate it if you would take our post survey as well. So Dr. Trigg, I have a question, and mine is based on all of your work and your research with infant mental health and early childcare and education. What policies do you recommend, either on the state level or a federal level, that would help support parents, caregivers, and teachers. Here at the Blanco Center, we are a public policy center, so we're very interested in like any of the policies that are going around in the state. So are you familiar with any, or have you come across any in your work and research?
Yes. So and I'm not always good at the names of things, but there has been at the state level money directed into a fund, and it's an early childhood fund that then matches networks around the state money as they raise money to put towards things like quality early childhood seats or quality wraparound services. And that has been a big supporter of the funding of the City Seats program, for example. And I know there are other communities that are also using it. I think Jefferson Parish is and some other ones. And having that state level money to match either all or a portion of funds that are raised at a community level through whatever works at that community is so impactful, because it allows for that partnership between community and state funding services to figure out what's going to work best at that community level. And so I fully support those types of programs that are looking at interesting ways of funding and then matching it so we have support across different domains. There are also some unfunded things that I've been involved in with the Department of Education, looking at workforce development and support, and how we can support teachers in getting the education that is needed so that they can make more money and have a ladder of success, so they can know what is the pathway if I want to join as an assistant teacher and then move up to a lead teacher and then maybe move up to a teacher mentor. And so thinking about how we as a state can put guidelines into place for individual child center owners to be able to support their own teachers. So those are some childcare level pieces. And then at the next level would be, how can we fund treatments? How can we fund more access to education for treatments? So anything that is looking at those portions, I think would be really important. Continuing funding of ECSS, which is happening right now in the state, early childhood supports and services. That's allowing greater access to early childhood families to get access to these really great treatments.
Awesome. Thank you so much for your answer. We have a couple more questions in the Q&A box. Someone asked, according to some teachers, their organization does not support research-based trauma-informed practices, for example, positive behavior support, which contributes to them being burned out and leaving the workforce. Can you talk more about how TIKES and programs like it can support the teachers to ensure cultural change within the larger organization?
Yeah, so I can definitely talk about how TIKES can support a teacher and hopefully an organization to think about trauma-informed and culturally informed positive behavior support, because that is so important if we're going to support young children and families and teachers. When we go into a setting, we are going to work to understand the experiences of all of the people in that setting. So it might be understanding that teacher's perspective, if I'm not feeling supported and being able to learn what I need to support my kids, but also understanding what are the barriers that are keeping that director or that owner or the leadership from being able to roll out those types of supports, and then working across that system to see where are similarities, which are probably, we want to support kids, and then figuring out how we can find a place of meeting so that we can support kids and families in the best way. This is why our work is long. We work with centers for 6 months and then we go back in because it is a process of making change. When we're looking at systems change, whether it's in a classroom or across a center or across the entire early childhood education setting, we know that it's going to be incremental small changes, but we've seen it in the places that we work in, and we hope to continue supporting teachers and directors and parents in making that incremental change where they are.
Thank you for your answer. We have several more questions in the chat. Another person asked, how closely do you work with the Training Grounds program?
I have one of our former mental health consultants now works for Training Grounds. There's that. We have partnered with them on many different things over the years. They used to be one of the wraparound supports for the City Seats program. And so we talked a lot about what trainings we were providing and what trainings they were providing. We refer families and children to them on a regular basis. So while we may not do a lot together, we are consistently talking to one another and referring to each other across programs. The pictures I have of them, they sent directly to me when I said I was going to be featuring them as an example. So we have a close relationship.
Okay. We have a question. What are your thoughts on TBRI?
Oh, yes. So I always have to take a minute. It's a trauma-based. Oh, look, there's Lisa. I might have to have Lisa type in what TBR because I'm blanking on it. I'm on the spot. It is a very good model. One of our consultants, one of our senior consultants, Lisa La Rochelle, who just also put a question here, is trained on TBRI, and she is consistently working with our consultants on understanding that model in supporting of young children and families. So it's certainly a good model that's out there and can support little ones. Thank you, Lisa. Trust-based relational intervention. I never can come up with it quickly.
No worries. Yeah, lots of acronyms to remember.
Yes, that's why we work in teams.
Yes, Lisa also asked, what would be your one wish, hope, or desire for early childhood educators?
That's hard because I have a lot, which you can just tell. But I think my biggest is that early childhood educators would be given the respect that they so deserve. They are helping us as parents to raise our next generation of citizens, and their work is so important, and yet they are often not seen as how important they are. So respect and elevation to the level they deserve.
Yes, 100% agree. Claudia asked, how can state agencies working with and serving children and families, for example, child welfare, workforce development, better implement IECMH best practices into their agency work?
Yes, so I'll say easy. One of the ways that we can most quickly get involved is through reflective supervision. And maybe a better term for it would be reflective consultation. One of the things that our group offers is reflective consultation to early childhood coaches. So we provide this in group formats through the TIKES program. We provide it in individual formats through the City Seats program. And it allows anyone who is working in early childhood settings to have a protected time and space with a mental health professional to think about the work. What's going well? What is struggling? What is a real challenge? How are my own beliefs holding me back? And so it's not therapy, though sometimes we may encourage someone to go to therapy, but it's a time to focus on the work and work through difficulties outside of your typical system. And we get wonderful feedback from the folks that we work with because they can reflect on what's going on and then implement things in a better way.
All right, thank you so much for your questions. And again, thank you so much for presenting. We are at time. I know we have a couple of questions left, but I just wanted to let everyone know that we are at time. And again, to please take the post survey that will be emailed to you shortly after. And also a reminder for our next month's Lunch and Learn will be presented by the Borough of Family Health and, the Borough of Family Health's ACE Educator Program. And it'll be focused on building parental resilience. That is on November 14th, same time. And you can register through the Eventbrite page that you all use to get here. And if you guys have any questions, you can stay behind and talk to me or Dr. Trigg. You are free to go otherwise.
Thank you, everyone, so much. Thank you to Blanco Center and Whole Health Louisiana. It was great. Great questions. Thank you, Quinn.
Thank you. And thank you to Nikki for interpreting. Thank you guys both for
Yes, hope I wasn't talk too fast for you, Nikki. Okay. All right. Bye.